Robert Hutson wasn't overly concerned when he felt a painless lump in his throat.
So I went to my primary doctor. He thought it was just an infection, gave me an antibiotic.
When it didn't go away, his doctor ordered a scan and then a biopsy.
And I just looked at him and said, "Are you telling me I got cancer?" And he goes, "You do."
The cancer had already spread from his tongue into the lymph nodes in his neck. A good friend insisted that he meet immediately with Dr. Henry Ho, medical director of head and neck cancer at Florida Hospital.
I just knew immediately that he was the right guy. You know, of course, he was very highly recommended also, but beyond that, it was just, I just knew.
And he really had very little symptoms, which is typical for this type of cancer.
Robert's cancer has been linked to HPV, or human papillomavirus, a well-known cause of cervical cancer in women, and recently an alarming number of head and neck cancers in men.
This is almost an epidemic in our practice. The virus is acquired sexually, and it infects the tonsillar tissues and causes a genetic alteration, usually decades after the infection. The typical head and neck cancer when I was in training was the 67-year-old veteran who smoked. These people are 30, never smoked, no symptoms, so it's a whole different disease. The good part about it is the cure rate is very high.
Robert was scheduled for transoral robotic surgery, or TORS, a high-tech, minimally invasive surgery through the mouth that Dr. Ho helped pioneer in Florida.
It went very well, got favorable margins, in other words, getting it all out, and everyone felt that he did not need any further therapy.
During a routine visit a few months later, Dr. Ho noticed a very slight, subtle firmness at the back of his throat that appeared to be the typical scar tissue from surgery.
I just had this, again, intuition that it's just not right. And I woke up that night thinking, something's wrong here. This doesn't smell right. I've learned over the years to listen to the inner voice. And I called him up the next day and I said, "Robert, we need to get a CT scan. I just don't feel good about it. I mean, I'm not sure what I'm looking for, but let's just do it."
The scan revealed that Robert's cancer had returned and was now up against his spine and carotid artery. Dr. Ho performed another robotic surgery, and this time Robert underwent both radiation and chemotherapy. He's now cancer-free and determined to help others by spreading the word about the HPV vaccine for children.
Well, you got to do it. It's just not worth taking the risk. It's in 80% of the country, and it's dormant, and why it manifests itself, nobody knows.
And we have to prevent it. So we have to educate the youth. They have to get vaccinated. It's not just the girls, but the boys have to be vaccinated now. You want to get the vaccine before you're sexually active. Once you're sexually active, it's too late.
Robert has battled his way through a major health challenge with the help of Dr. Ho and a huge team of experts, all part of Florida Hospital's multidisciplinary approach.
No one person has the answer. That is the danger. If all you got is a hammer, everything looks like a nail. Multidisciplinary approach is that a patient is presented to our tumor board, and the input of all these specialists. We do a video broadcast from Winter Park Hospital to Celebration, to Altamont, to Kissimmee, to Orlando campuses, where those radiation oncologists, those surgeons, so we all collaboratively come up with a treatment plan.
I felt strongly that there had to be, there was as good a care here in Orlando and with Florida Hospital than anywhere else in the world.